This online seminar, entitled Getting Back to Business, Post-COVID Workplace Policies and Regulations, was organized by the European American Chamber of Commerce of Greater Cincinnati in collaboration with the law firm of Porter Wright and was recorded on March 31st, 2021.
We have about 40 people registered for today's event. I'm sure we're going to have a really vibrant discussion. I do want to remind you that all comments by our presenters are their own. They do not necessarily represent the views of the EACC or our members. And with that, while I mention our disclaimer, I'll put up the Porter Wright disclaimer because they've got theirs as well. And you can read through that while I set the scene a little bit for our discussion today. So think back about 13 months from now. Recall those news reports that suggested there was going to be this new virus and this new pandemic that had the potential to really shut down our economy. And then you think about those last weeks of February and early March, when people were cleaning out the grocery shelves and you couldn't find hand sanitizer to save your life. And then, of course, at some point, your business probably came to you and said, hey, we are closing. You need to go home. We're going to close. You need to pack up, whatever. From the federal government to state, county, local health officials, there's all these different orders and mandates, issued in the name of safety. And of course, as a business leader, you're trying to figure out how to comply with those, both to protect your employees and to avoid any kind of legal jeopardy. Now, maybe, we do see vaccination rates rising, especially here in Ohio. We see the number of cases seems to be leveling off. And we see business leaders, again, scrambling to try and grapple with these new rules, these new regulations, this shifting ground that we're all standing on. I'm really grateful to our friends at Porter Wright for helping us organize this event and especially for lending us the experience and the talent of our speakers today. Let me introduce them. John Carney and Michael Underwood are both partners with Porter Wright, Morris Arthur. John is a member of the firm's government relations team and chairs their healthcare practice. And among his many accomplishments, he also served 3 terms in the Ohio General Assembly. Michael focuses on labor and employment law, including for our purposes today, advising firms on OSHA compliance and how to minimize legal risks and improve employee relations. So, Michael, before we get started, I'm going to turn to you, but I just want to get a better sense of our audience today. So I'm going to post this quick poll. You're going to see this appear on your screen, ladies and gentlemen. Would ask you to answer these 2 quick questions. Overall, how would you describe the impact of COVID-19 on your business operations in the last 12 months? Has it caused no major disruptions? Has it caused some minor disruptions? Or has it caused significant disruptions? And then the second question there, have COVID-19 restrictions on your companies, mask requirements, 6-foot distancing, temperature checks, et cetera, have those caused personnel challenges for your business? And that's just a simple yes or no. We've got about half of our folks have responded. I'll give you just another minute. Michael, as you might not be surprised, we've only had one person say no major disruptions. Pretty much everybody else is indicating at least some minor disruptions, with about a third of the respondents describing significant disruptions, and about 2/3 have indicated that the restrictions have caused at least some level of personnel challenges for their business. So with that, maybe as a background, why don't I just turn it over to you and talk about how are companies addressing this and what kind of challenges are they facing and what are they likely to face as they go forward?
Sure thing. Thank you, Todd. And you're right, those poll results are not surprising at all. I'd suggest they track pretty closely with our experience representing clients across all industries for the past year. And the challenges have changed, modified over time. Employers have gotten smarter about the way they have addressed the challenges. And now, with luck, and there's reason for hope, that we're turning the corner a bit and that there will be a more robust return to work. And that means that the challenges and the issues are slightly different. And so what I want to do with my time is tee up 3 employment law, employee relations considerations that are very much current in terms of dealing with the pandemic. And those 3 are, number 1, COVID vaccine, and number 2, workplace safety. Specifically, what is OSHA doing? What is OSHA not doing? Where do you as companies turn for your guidance on workplace safety measures related to the pandemic? And then last, I want to spend a few minutes just talking about what is next. What do we expect, both in terms of workplace challenges and also in terms of any future government action as we transition, hopefully, into a slightly different phase of dealing with the pandemic. We do want to be respectful and mindful of leaving a good period of time at the end here. That's the way we've got this budgeted, so that John and I will make some remarks, but we're going to have a good period of time in the second half of this presentation for discussion and questions. My experience is that's frankly where you get a lot of the more valuable insight on things, an opportunity to hear what you have to say and also what your colleagues in similar positions have to say. So, vaccine. Obviously, many employers want to encourage their employees to get the COVID vaccine. It's the best method to get people back to work on site safely. And so a question we're often asked is, can we require it? Can we mandate it? Can we tell employees, you're going to have to get a COVID vaccination as a condition of employment? And often the answer surprises people, because the answer is yes, you can mandate that people get a COVID vaccination as a condition of employment. The federal agency that monitors and enforces discrimination law has said a COVID vaccination is not a medical exam, therefore you don't go down the path of all the regulations under the Americans with Disabilities Act. You can mandate vaccination. One caveat: if a person is unable to be vaccinated for a medical reason or is unwilling to be vaccinated for a legitimately held religious belief, you're expected to make a reasonable accommodation, which generally means try to figure out some way to keep that person working despite the fact that they're not vaccinated. And that could come at some small cost to the employee, and as much as you might assign the employee differently so that they are not as frequently exposed to the greater workforce. These things feel uncomfortable to employers and particularly to human resource representatives, because it just doesn't feel right to be telling people what to do on an issue like this. But I think the greater recognition is workplace safety is preeminent here, and that's why you are entitled to mandate. Now, as the old expression goes, just because you can do something, that doesn't mean you want to do it, doesn't even mean you should do it. And my experience is that most employers are choosing not to require employees to have vaccination. And there's a number of reasons for that, not the least of which is employee relations. Some companies are just uncomfortable, understandably uncomfortable, even if it's legal, telling employees to have a certain medical procedure, even if it's only an inoculation. Also, there are questions of enforceability. You tell people you're mandated to be vaccinated, and yet how difficult is it in your area to even get an appointment for a vaccination? And how are you going to enforce whether an employee's really engaging in a good faith effort to get a vaccination? There could even be Fair Labor Standards Act issues if you mandate vaccination, because an argument could be made that the time spent getting the vaccination now is paid time for non-exempt employees. That's not been tested, but it's something that people speculate about. Okay, so mandating vaccination is a possibility. Most are not going down that path. Instead, most employers that we work with are encouraging their employees to be vaccinated. The most common method I've seen being used for that is additional paid time off. The notion of adding, for example, a day or two of paid time off to an existing PTO bank, with the notion that it will encourage employees to miss some work time if they have to get vaccinated, if they're not going to lose, or at least they've got the opportunity for that time to be paid time. Think about verification if you're going to encourage vaccination. If it's simply encouraged and not mandated, you really, I suppose if you're offering an incentive like a PTO, you may want verification, and that would be presenting a copy of the vaccination card. People sometimes worry about that. To me, All that vaccination card has on it is the fact of vaccination, name, and birth date, which you as an employer probably have already anyway.
Michael, let me just step in here. One of the questions that came in already is, can we ask employees if they have been vaccinated?
Yeah, and the answer to that is yes, you definitely can. Now, the question becomes, what do you do with that information? Because the point I was just about to make is, even if an employee has been vaccinated, you are at this point in time not supposed to be relaxing in any way your rules regarding the mask mandates, regarding social distancing. All of the things that you have in place for safety must remain in place. I'm going to mention that when I talk about the workplace safety. So you may find out if a person's been vaccinated, but for all intents and purposes, that person is not supposed to operate in any different fashion than your other employees are. So next, I mentioned that I wanted to talk a little bit about workplace safety, OSHA, and other forms of government regulation on workplace safety. From the start, of course, you've been interested in workplace safety as responsible employers. The government's been interested in workplace safety. You know that the CDC has issued guidelines for safe return to work. Most state and local health departments have guidelines for safe return to work. But where do you look for a definitive standard, something that says, here are the things you have to do concerning this particular hazard? Your training with respect to workplace safety is that you look to federal OSHA, or if you're in a state plan state where the state regulates OSHA, you look there. OSHA does not have a standard specifically applicable to a pandemic and has not developed a standard specific to COVID. There has been a great deal of pressure on OSHA in recent months, including an executive order from the president and including a pretty critical report about OSHA from the Inspector General, both of which direct OSHA to look very seriously at developing a COVID standard, spelling out specific regulations, but they've not yet done so. That is not to say there are not guidelines from OSHA. There are. Right from the start, they've been publishing detailed guidance on what employers should consider for workplace safety. So what does that say to you as employers in terms of trying to manage this issue? First, yes, unfortunately, you've got multiple sources to look to for guidance, but primarily those are the CDC, whatever your state and local government guidance is for safe workplace. But then do not stop short of going right to the OSHA website if you haven't done so already. It's prominently displayed. You will get quickly to the OSHA guidance for COVID-related hazards. You want to maintain your standards in the workplace as closely as possible to all of these standards as you can. There's not that much inconsistency. You may find a little, I know some of you operate across the country in many facilities. You may find a little variance from state to state, but not significant variance. A key, though, is to be vigilant in enforcement. You don't want to have that worst case scenario where you go to all the time and effort to develop good standards, and at the plant level, people are not strict in enforcement. And the worst case scenario, then you have a cluster of cases, and perhaps somebody who gets very seriously ill, or God forbid, somebody dies. And if they're able to work backwards from that and say, well, wow, here's a cluster of cases, number one. Number two, they aren't enforcing their own standards. Those are the kinds of facts you absolutely don't want to have. So please be vigilant to the guidance that exists. And shifting over quickly to the what's next category, I mentioned that OSHA has not issued a standard. They have not said definitively that they plan to do so, but all the signs are that will happen. Kind of ironic, because if we're all right in our hopeful expectations, we may be turning to the point where a standard specific regarding coronavirus becomes less important. But nevertheless, OSHA has said they will issue a standard. OSHA has not been silent. Well, of course, I mentioned already they've got detailed guidance. They've also issued a national emphasis program, which means they're going to look very closely, very hard at places where COVID exposure is particularly risky, like in meatpacking plants and places where lots of employees work in close proximity. And OSHA has received many complaints about alleged COVID hazards, have conducted inspections, including remote inspections. They do issue citations. keep an eye out, because that is probably the next big development from the federal government, is more OSHA enforcement action and more OSHA clarification on a standard for COVID hazards. Beyond that, I wanted to mention again that the fact that even as vaccinations increase, you are expected in your workplace to continue your mandates for masking, for social distancing, for cleaning the work area, for quarantining as appropriate. So those things will remain in place. I had a client ask me recently, even after the mask mandate is lifted, we want to continue mandating masks for a while. And the answer was easy. You can do that. There's no prohibition, making reasonable accommodation for people who have medical reasons. So I think we all have to remain flexible, because the workplace has changed, probably changed for good in some respects, but a lot of the particular restrictions are gradually going to be rolled back. So keep your eyes on those CDC guidelines, your state and local guidelines, and OSHA guidance. They will modify, they will change over time. Just make sure you're sticking to strict compliance with those until they are modified. Last, you can expect that the Biden administration is going to be more open to, more amenable to initiatives that are employee protective and employee friendly. And so there could be initiatives further concerning things like paid time off. As I mentioned earlier, there's already been a presidential executive order encouraging OSHA to be more aggressive on this issue. And then the last issue I wanted to mention, only indirectly related, and I'll call it a work at home pushback. As vaccination continues, there's going to be a call to get more and more people back to the workplace, and there are going to be some employees who resist that. And that will put you into the category of can you insist that somebody come back to work? Generally speaking, of course, the answer is yes. There is the issue of reasonable accommodation if a person has a medical condition that suggests they ought to stay home. Where that intersects with COVID is if the person says, I'm highly susceptible to serious illness from the virus, my doctor has said I should work at home, then you're going to have to engage in that interactive dialogue about reasonable accommodation. I do want to stop there. I want to make sure John has plenty of time for his remarks. As I mentioned earlier, we do have reserved a full 20, 25 minutes in the second half of the program to take all of your questions. Thanks. John?
Michael, let me just step in real quick and say thank you so much. A reminder to everybody, as you said, if you do have questions, please be sure to submit them. We had an event last week where we talked to HR managers, and that whole question about who comes back to work and when do they come back to work. I mean, that's a whole other set of issues in terms of just how do you manage relationships with your personnel. But having a strong legal basis for doing that too is really important. But John, let me let you go ahead and step in and talk about sort of some additional elements of the legal framework.
Thanks, Todd. Thanks, Mike. Well, I'm going to spend my time today talking about vaccine passports, which have been in the news quite a bit as of late. Really talking about why is there a demand for vaccine passports, what they are, examples of vaccine passports that have already been promulgated by various organizations and governments. And then, specifically, what's the EU doing? What's the U.S. federal government saying? What are states saying about COVID passports? What are the objections to COVID passports? And what does it all mean to your business moving forward? Where are we going with this? So first off, what's a vaccine passport? For a lot of people, yes, there's discussion about them now, but if you've traveled internationally, you already know what a vaccine passport is. If you've dealt with the yellow card before, that proves that you've been immunized against malaria or rubella or cholera, you have to carry it with you in order to enter certain countries or to go into national parks in those places. You need to have that available and demonstrate I've been inoculated against these viruses in order to be admitted. If you have school children in public schools, you're very familiar with the fact that they need to get MMR, and you have to be able to demonstrate that to the public school system in order for the school to allow your child to come to school. And so although there's a lot of discussion right now about whether or not COVID vaccine passports should be allowed, whether they're ethical. The long and the short of it is they've been around for quite some time already. And so it's probably the politicization of COVID that's making it such a controversy. Obviously, for those of you who have traveled, whether it's in the United States or you've traveled back to Europe, you know the process of going through, well, I've got to get a negative COVID test, and then I have to quarantine when I get there. And it provides a lot of additional hassle to individuals who want to travel. And if you are now 2 weeks beyond getting certain COVID vaccinations, we know that you're 90% likely to not become infected and unlikely to spread the virus. And certainly out of the European Union, you have a lot of countries who are trying to salvage the summer travel season. I mean, Greece has already made deals with Israel. They're looking to make deals with the United States. They want people to come back. They understand that if they're telling people you need to get a COVID test and then you have to quarantine for 14 days once you get here, that's not a very inviting place to want to travel to. And so really a big push is from industry saying, we are dying here. We're restaurants, we're hotels, we live off the tourism industry. We need to have a vaccine passport for COVID because that's going to enable the free travel of people, specifically for the EU within the EU member nation. So less about whether or not we can get Americans there right now, and specifically about can people who live in Italy go to Germany and travel around the European Union and spend their money and vacation and hopefully help to revive the economy there. There's a lot of debate, though, about, okay, well, what vaccines, though, should count as qualifying for the vaccine passport? Because, certainly Pfizer, Moderna have been approved by the European Medicine Agency. The CDC has approved Pfizer, Moderna's, J&J, AstraZeneca's has been approved by the European Medicine Agency. But the Russian Sputnik vaccine that's being administered in Poland and Hungary, the Chinese Sinopharm vaccine, neither one of these have been approved. Would those then qualify to be part of this vaccine passport program? So big questions for the European Union. And certainly, given the whys of why we want this to happen, the European Union has already come forward and said, we're going to create a digital green certificate. It basically will demonstrate whether or not the person has gotten the vaccination, whether they've had a negative test. And in fact, the European Union's even saying they're considering the idea of, have you had COVID and recovered from COVID? Now, there's a lot of debate on that last one because our health experts don't know how long the immunity will last. And so a number of health experts are saying that should not be a category until we can determine how long the immunity will last post having a COVID infection. So I think this is going to continue to be a discussion. I think the passport will definitely include whether or not you've been vaccinated. And if you haven't been vaccinated, when did you have your last negative test? And so that will start to enable people to travel. Let me give some examples of passports that have already been developed or are being developed. I mentioned the EU has proposed this digital green certificate. The International Air Travel Association is developing a travel pass, and many international airlines have already adopted this. And so again, the airline industry too is anxious to get more people on their planes, and specifically the idea that you've been vaccinated and you're 2 weeks beyond that, second dose if it's Pfizer, Moderna, or the first dose if it's J&J. That will then enable more people to seamlessly travel internationally. Denmark, Iceland, Sweden are all pressing ahead with their own vaccine passport program separate and apart from the EU. So you may have read that Denmark at the beginning of February essentially said, once you've been vaccinated, we will issue you a passport. A number of countries, Belize, Cyprus, Estonia, Georgia, Iceland, Lebanon, Lithuania, Poland, Romania, the Seychelles, Slovenia, Thailand, have all said now, if you have a vaccine passport, you can prove that you've been vaccinated, we will let you into our country. You will not have to quarantine. So as you can see, this is going to become a significant incentive by countries to say, look, we need people to start traveling to our country. What can we do to promulgate a passport that's going to enable it? Let's talk a little bit about the patchwork that we've all seen, because I talk a little bit about what the various members of the EU are doing separately. Well, in the United States, we've already had the White House come out Monday saying, we don't think this is the purview of the federal government. We think private business should really be the ones who are pushing forward, a vaccine passport. Specifically, the Biden administration is indicating we don't want to have that data. We don't want to be responsible for that data. And we really think it's private businesses that should be doing it. At the exact same time, New York State has come out and said, we are going to have a COVID passport for New York State. So if you want to go to an entertainment venue, you're going to need to be able to flash your passport. If you want to have a wedding that has more than 25 people, you're going to need to be able to demonstrate that the people who are coming to the wedding have been vaccinated, and that will then allow you to have greater capacity at your wedding ceremony. At the same time, on the flip side, the Florida governor has said by executive order, he is going to prohibit the use of COVID passports. But that prohibition, whether it be by executive order or if the legislature took action, likely would only apply to public venues. So, certainly state government can say, well, we're not going to require that someone demonstrate proof of a COVID vaccine if they're coming to, let's say, Florida State University, because it's a public university and we don't want to require it. But with respect to private businesses in Florida, I think it's going to be much more difficult for Florida government to act and say private businesses cannot require, whether it's a private concert venue, if it's a private restaurant or bar, if they want to say, no, if you want to enter our doors, you need to be able to demonstrate either that you've had the vaccine or proof of a negative test within the last 72 hours, the likelihood is they're going to be in a good position to require that. And so what does that look like? Is it a piece of paper like the yellow card that you hold? Well, IBM has already generated through its blockchain technology the ability to essentially have an app. It creates a QR code. This is what New York's going to be doing. So they're working with IBM. And essentially, you would come in, you would show your phone with the QR code, it would be scanned, and they would know whether or not you've been vaccinated or you've had a negative test. This has particularly become of even greater interest because we know that there are false tests that have been sold in a number of places for people who are traveling internationally. There was just, some stories in the news about how in Paris, individuals were looking to travel internationally. They bought false negative tests. They used those to travel internationally. And so the idea that you can have an electronic verification system that's harder to falsify is also something that's very intriguing to the airline industries and others who know that there's these sorts of fraudulent tests taking place and are concerned about what the impact might be on their ability moving forward to safeguard passengers on their planes. What does it all mean? Well, vaccine passports are here and they're going to be here to stay. I think that it's only going to grow, obviously, given the fact that you have the EU generally, member states of the EU, individual states in the United States, private businesses who are all indicating this is something that we think we need to do. I don't see this train slowing down at all. I mean, if we had it for the ability to get a kid into school, we're going to have it for COVID-19. And I think the frustrations around the inability of people to get out of quarantine for 2 weeks is going to be a greater incentive for a lot of places, especially travel destinations, to say, this is what we want. This enables people to arrive here, for us not to hassle them, for them to start spending their money immediately, to travel without restraint. And so, I think it's definitely coming. Now, there are a lot of legitimate objections to having COVID passports right now. The World Health Organization has already stated that they're concerned that if COVID passports become the norm, especially for international travel, that there's going to be an incentive to divert vaccines to people who have higher income, a likelihood to travel internationally, and that there's going to be an impact, especially on lower income populations. I mean, I'm already talking about the fact that this is going to be a smartphone app. Obviously, there's a lot of people who do not have access to a smartphone. And the Biden administration this week said, well, if it's going to be promulgated, if there's going to be a passport, if private business is doing that, there really needs to be a paper equivalent of it. But that creates a whole host of problems. I mean, for those who have studied the development of the passport program, just generally, the worldwide passport program, it took 50 years to develop the global passport program. And when they decided that they wanted to add biometrics to the passport program, that took another 10 years. And so what you're looking at as individual states, individual countries, the European Union or others start to promulgate this is how do those all work together? Because you can't be exiting an international flight and you realize, well, 10 people have this and 25 people have it electronically and another 30 people have it on paper, but they've all been issued by different organizations. And so when you're trying to enter the country now and you've got 100 people deplaning, how long will that process take if there isn't a unified approach to it? And so there is going to have to be coordination. And unfortunately, the pandemic has not demonstrated coordination, whether it's the EU member nations or the United States member states. We have not worked well together. And I think there's a lot of concern that moving forward, it's unlikely that there's going to be a unified process and that this is going to create a lot of challenges with respect to how do we unify a passport program. Not to mention the issues that I mentioned earlier with respect to the efficacy of these various vaccines and whether some of them are looked at as more effective. And so those will qualify for the COVID vaccine, but others that are available internationally will not qualify. And so again, this will be a debate. There's clearly going to be privacy concerns. I mean, certainly in the United States and in Europe, there's a heavy burden on healthcare privacy. And so access to that information, I mean, IBM saying that their solution uses blockchain, and so it will safeguard all that healthcare information. As Mike Underwood indicated earlier, when you're talking about date of birth, your vaccine status, or are we talking about communicating all that much private health information if all you're communicating is, I got a vaccine? I tend to agree with that, but I think there's going to be a lot of debate around it. Another big issue is by the end of this year, 1 in 4 nations will have administered no COVID vaccines. And so, COVID anywhere is a threat everywhere. And so this idea that, oh, well, now we're safe because I can flash a COVID passport, but 25% of the countries in the world haven't administered any vaccine by the end of 2021 should provide concern to everyone. How safe is this really going to be? What do we know about people who have been vaccinated and their ability to contract the virus and still spread the virus? And so there's a lot of discussion in the healthcare community about the fact that we really haven't gotten to those conclusions yet. So we rush forward with the passport and people start to see that as proof of your inability to contract it and spread it. And then we determine later on, no, that's actually not true, especially with these new variants. Then I think that's going to create some additional concern and additional pushback against the idea that a vaccine passport is appropriate. At the end of the day, each organization, each business really needs to think long and hard about what makes sense for you. I really think you can't be relying on the fact that whether it's the European Union, the US federal government, state governments, local governments are going to get their arms around this and solve this problem. As I indicated, and as you all know, the politics of COVID have been, very far flung choices by a lot of different people in positions of authority. And so I think each business is going to have to think about what should we think about with respect to implementing our own COVID passport program? Because at the end of the day, as I started off my discussion with, it sounds fancy, COVID passport, but really it's an ability to get admission, whether it's admission to a country because, you didn't have rubella or malaria, or you're inoculated against it, or the same with school children, the ability to go to a public school on a day-to-day basis. It's really the ability at your business to say, I'm going to be a safe employee. I'm not going to show up, have COVID, and pass COVID to people in the workplace. And so I think that that's going to be an ongoing conversation. And, certainly if you're a leader of your business, you need to be thinking about how are we proactively going to implement our own program and not rely upon state, federal governments to enact a program, because it's unlikely that that's going to fulfill what your basic needs are, which essentially is, how can I get my employees back to work safely? How can I make sure that I limit any liability to my business? And that's why you want to make sure that you're consulting with good legal counsel who can work through the issues that Mike's addressed and that I've addressed, because ultimately it's going to take some discussion about the specific needs of your business. So having said all that, I can see a number of questions have popped up. So I'm going to reserve the rest of our time to take some questions and kick it back to you, Todd.
John, thank you so much. I mean, you've raised so many different issues, and particularly for the EACC and the concerns that we have. I mean, you can only imagine the number of companies that have been inconvenienced by the inability to travel, with European executives who needed to come here, technical travel, whatever it happens to be. One of our companies was trying to get a whole new automated warehouse installed. Well, all the equipment was in the building, but the German engineers could not get into the country to actually set it all up and get it operating. That's been resolved, but and that's just one example of thousands. I will say that the one thing that came to my mind when you mentioned Florida was, of course, the idea of going to the Epcot World Showcase and having to show my my vaccine passport as I go from Japan to Mexico there at Disney World. But seriously, obviously, these are really, really important issues. We do have a number of questions. I would remind you again from our audience, if you have questions, comments, reactions, thoughts, please feel free to put them in the box here in the chat box. Mike and John, to a certain extent too, a couple of people have asked this specific question. Your company's got all the right protocols in place. You've been enforcing them appropriately. Let's say your employees have all been vaccinated. Ohio Department of Health still says that you've got requirements for social distancing and masking and so forth. When can you step back from some of those kind of things?
My advice is this: you step back from those things when the guidelines change. And even though it may seem counterintuitive, it may seem illogical even, your best guidance is what the government is suggesting. And I would not step away from masking and social distancing until the guidelines established in your location have been changed along those lines. And as I mentioned earlier, you have to take a look at Osha Guidelines as well. Here's the reason. It may make all the sense in the world to do so. And by the way, Todd, a related question was, if all of my employees are vaccinated, can't I just relax all these requirements? And that does illustrate the seeming illogic of having to continue the mandates. But my advice is continue masking, continue social distancing, as long as that's what's being recommended by the applicable authorities. You don't want to be the employer, and sadly this happens too often, where they end up being sued on an argument that they've not complied with the guidance. And even though there may not be any real merit to the allegations, the fact of not complying with the guidance, that's the sort of thing that turns a quickly dismissed dispute into one that lasts for a long time and costs a lot more.
Related to that, a question came in: as mask mandates are lifted, can employers force only non-vaccinated employees to wear masks?
Yeah, that's an interesting question. The short answer is yes, and I say that because there's no protected status for the person who chooses not to be vaccinated. So in a general sense, you don't have discrimination law concerns if you treat the vaccinated person differently than the non-vaccinated person. So yes, you could do that. And some employers are even considering that those who have not been vaccinated, as I mentioned earlier, we're going to assign different schedules. We're going to place in different areas of the facility. Those things are opportunities for you to consider. I would strongly encourage you to think about the employee relations aspects of doing those kinds of things. It can be, I think, a significant negative reaction. And so I would plan carefully, and I would minimize the impact that you're going to drop on folks who don't have a vaccine. And don't forget that reasonable accommodation. Before you take a negative step for a person who doesn't have a vaccine, make sure it's not because of a religious reason, or at least they haven't told you it's because of a religious or a disability reason. If so, get in touch with your counsel and figure out the accommodation duty.
Fair enough. Mike, we had a couple of technical questions that came in as well, specifically on Osha Guidance. Do I have to include positive COVID cases on our Osha 300 logs? And if the answer is sometimes, what facts should I consider in deciding?
Okay. Yeah, that's a very good question. So first, for context, the question is, an employee has a confirmed positive test for COVID. What do we have to do? First piece, if anybody has any question about whether you would have to report that to OSHA, the answer is no, you do not have to report that to OSHA. The harder question that the person has raised is, do I have to log it on my OSHA 300 log, which is a log of all workplace illnesses or injuries? Well, your instinct should tell you, is it a workplace illness? Did this person contract the virus at work? And in most instances, the answer is no. And in most instances, there are no facts that would suggest they did. Now, there is OSHA guidance specifically on this point, a series of questions that OSHA suggests that you be asking employees who have a positive test. And they're questions like, did you have exposure away from work? And the bottom line is, it's just a cut to the chase. Unless there's a cluster of cases occurring within close proximity in time or other clear evidence that you ought to consider workplace related, then do not record it on your logs. But if there's a cluster of cases all occurring within a few days, you probably do have to conclude, yeah, that's at least the odds are that's a workplace illness. It goes on your OSHA logs. It doesn't necessarily have any further negative impact on you.
Fair enough. Fair enough. So yeah, so the unless you can really demonstrate that it's a workplace related infection, you probably don't need to report it.
Yeah, what OSHA is basically saying to you is, don't just presume it's not. Go through the steps, analyze. Or have we had other cases? Has this person been in contact with another confirmed positive person at work within the past 10 days? Those are the kinds of things OSHA wants you to think about.
Fair enough. Separate question, you mentioned about requiring vaccines. Some companies are offering PTO or other incentives, but if you do require a vaccination, would you be required to pay for the time off for an employee to get it? What if they have a bad reaction? Is that considered sick leave? How does that work? Or, and if I don't require it, but I give incentives, what do I do for the employees who aren't, as you say, are not going to take the vaccine? Do I have to offer them the same benefits?
Right. Couple of things. Number one, when you are simply encouraging but not mandating the vaccine, then you never have to worry about whether you are required to treat the time as paid time. If you were mandating the vaccine, that becomes a gray area question that hasn't been determined. So I'm not talking now about a PTO benefit. I'm talking about, is it hours worked that you have to pay them for? That only comes into play and if it's mandated vaccine, and it's only a maybe. It's not a clearly determined issue. Now, when you're only encouraging the vaccine, you never have to worry about being required to treat it as paid time. The encouragement is, as I said earlier, often it's paid time off. I'm sorry, the beginning of the question, refresh my memory.
If you require them to get a vaccine, do you give them, are you required to give them PTO to go get the vaccine?
Okay, so the answer to that is no. You're never required to give them PTO as a reward. Some employers are choosing to do so. So breaking it down into three pieces then. If you're mandating vaccine, there's an argument that maybe the time spent getting the vaccine is paid time. You got to pay them wages for the time. That's one of the reasons employers are kind of shying away from mandating. Number two, when you're just encouraging, no, you're not required to give anybody anything. You could just encourage, educate about the vaccine and then encourage. Many employers are choosing to offer some additional PTO, paid time off, and a bank of paid time off to encourage folks to get the vaccine.
A real world example, we were talking to one of our member companies the other day. What they did is they had developed a really good relationship with county health officials here in Ohio. They actually turned their factory into a mass vaccination site, got about 1,000 people vaccinated over the course of a day from employees and families and so forth. Part of the incentive was they even gave out T-shirts, I believe, that said something like "Immunity Community," which I thought was cute. But for those employees who didn't, who weren't able to take the vaccine or just declined to take it, they offered them a benefit of, if you take this class, this seminar, and I don't know how long it was, on sanitation, on protecting yourself, and so forth and so on, you get the same benefits as the people who got the vaccine. So, I mean, lots of companies are trying to be very inventive and forward-leaning on this. So, John, I want to come back to the passports question. I mean, let me just see if I understand. I guess my question would be, how would be requiring somebody to present a passport as proof of vaccination? How is that different, or is it different from requiring somebody to demonstrate to provide proof of a negative COVID test for entry into country A?
Yeah, I mean, ultimately, it does not appear to be significantly different, except for the fact that with the vaccination, there's empirical data that demonstrates that you have a longer period. If I don't have it today, but I could have it tomorrow, and so you could still contract it versus somebody who has the vaccine. Now, I think there's going to be. I saw one of the questions was around, well, given the fact that there's information that's not known about the vaccine, or we're going to have to continue to update the passport as time goes along. And I think that absolutely that may come to pass. I think the epidemiologists that we're talking to, the infectious disease experts we're talking to, are saying we don't know. It may be that you take these 2 shots and then you're fine moving forward. But it may be that it is like the flu, where every year you get another booster for it, where it includes several of these variant strains, and then you get another booster shot, and then that ultimately keeps your immunity. It's not immunity. I mean, it's 90% effective for Moderna and Pfizer currently, but it may need to demonstrate, yes, and I got my booster at the appropriate time, provided that those companies come back out and go through the process. Because we're at emergency use authorization right now, so they'll continue to learn more about the vaccine's efficacy, and then it may be, yes, you need to get a booster, or else now your passport's denied because yes, you got a shot a year ago, but you didn't get the booster, so now the passport's denied. But with respect to your question, Todd, on a negative test, I mean, I think ultimately countries, airlines, businesses are going to be a lot more comfortable with the vaccine because, one, these tests are only effective at the moment they're taken. It doesn't say anything about what happened to you after that moment. And also, at the end of the day, we know there are fraudulent negative COVID tests that are being provided to people, and it's becoming more of a problem. And so I think that's why, this QR code where you're able to demonstrate, oh, this is where you got it, this is when you got it. It demonstrates a tie back to it, and they can verify it. Makes it a lot more worthwhile for the airline, the restaurant, the business owner to be able to demonstrate that, in fact, you're unlikely to have it or spread it to anyone.
Right. Just a reminder, our time is coming to an end. So if you have any last minute questions, please be sure to go ahead and just drop those in the chat box now. And just a personal reflection. I mean, so my first job, I was a consular. I worked at the U.S. consulate in Frankfurt, West Germany. This was a very long time ago when it was still West Germany, and actually was involved in the first machine readable passports that were issued outside the United States. As you talk about the process of trying to come to an international agreement on those things, I mean, the EU has been together for more than 50 years, and you saw when this pandemic erupted, they rush to close those international borders, and the confusion that creates. Even here in the United States, you had states saying, well, if you come from such and such a state, you're going to have to quarantine for 2 weeks and so forth. So what I think most people find frustrating is just the fact that we just don't know. I mean, we look to scientists and experts to give us some degree of certainty on these things, and there's just no certainty. We're still very much in the early phases of this. The one thing I would say is also, you talked about the approval process and so forth. I mean, I know the German government, or there are elements in the German government already that are saying if the Sputnik is approved by the World Health Organization, then or by the EMA, then yeah, they're going to start pushing that out as fast as they can. And I'm sure there are people from Germany who are traveling to Poland and elsewhere just to get that. So it's going to be. We're living in a world of uncertainty. We have to be really careful, and this goes for everything Mike said as well. We're living in a world of uncertainty. We want to be optimistic, but we cannot allow our judgment to be clouded by our optimism. We are far from the end of this. The idea that everything's going to go back to normal, whatever that is, by the end of the year, I mean, that doesn't make sense. We have to go step by step, be very cautious, but at the same time, do everything we can to make sure that our economy, can grow, and businesses can operate, and travel can resume, and so forth. Not just for our own sanity, but for the economic well-being of the people in those industries and businesses. So.
Well, and I would just add, Todd, I mean, you're right, it's uncertain, and your political leaders are all over the board really on how this should proceed. And so you as a business owner need to be being proactive about what's our plan moving forward. And, how do we make sure our business is safe and our employees are safe? And what are our policies around this, instead of necessarily looking to state elected, federally elected, EU elected individuals to make those determinations. I mean, as Mike says, you need to follow their guidelines, but you also have to be thinking about what are the right policies for us, and how do we make sure that we frame them for our business and our employees and communicate them to them, because they're going to hear a lot of different stuff. They're going to hear, these COVID passports are invalid and nobody's going to be able to enforce them. And then they're going to go to the concert venue or the stadium and told, you can't get a ticket to come in. Or they're going to go to the airport and say, I want to travel here. And it's like, okay, well, you're going to have to quarantine for 14 days when you get to Germany. And so you're not going to be able to do your business meetings. And so you need to come up with your own plan and not have an expectation that some government authority is going to tell you this is how it's going to work. Because, my review of it, and Mike's for sure over the last year, is, wow, this is a patchwork. And when we're advising our companies, I'll say this is how it is in Ohio, but in New York, it's like this. And in California, it's like this. And so it's like, what? We got to talk to this health authority, and we need to have these different policies in place here. Why is it different? That it's how it's been operating the entire pandemic. Each jurisdiction has its own rules. And so you need to figure out, how do I work within my footprint? How do I make sure I create a safe working environment for my people moving forward?
Absolutely. And John, just a real quick, any industry associations that you think have done a really good job of stepping up, either at the state or at the national level, of engaging with government officials on this? National Association of Manufacturers, Ohio Manufacturers Association, others?
I'm not sure I could pick out one and say they've done particularly well. I know that we at Porter Wright have interfaced with state government officials really across the country on these issues for our clients. And I tend to think you need to find people who have direct rapport with, in Ohio, certainly Governor DeWine's office. And we would be talking to his cabinet member saying, this is what the ODH order says. Are we okay doing these things? Because it's not totally clear to us. And can you provide us something in writing that basically confirms how we're planning to proceed? And so you really do want to have a legal expert who's working with you. The associations oftentimes will say, well, yes, this is generally what we think, but you should talk to your own legal counsel. And so, that's what we think too. We think you need to go directly to your own lawyers. They need to be able to interface with those government authorities. I mean, just as an example, we had an order from ODH that was essentially, saying that providers should be able to get into nursing homes and other things. And nursing homes were basically saying, no, you can't come in. And so we needed to go and get the director to clarify for those nursing homes, you can't deny entry to mental health professionals. They have to be allowed in. But for our ability to go get that letter directing the nursing homes that they had to let these people in, they would have continued to deny them access, even though they had a patient relationship with somebody in the nursing home. And so that's why it's so important to make sure your specific business is interacting with counsel who can help you with those issues.
Exactly, John. And that's a good reminder. Again, with the disclaimers that we put up at the beginning, please don't take any of this as specific legal advice for your company or your business. Be sure to work with your local counsel, your company counsel. And if you don't have one, I can recommend a really good law firm that we spend a lot of time working with, and happy to make that referral for you. So that brings us to the end of our event today. This concludes our webinar entitled Getting Back to Business Post-COVID Workplace Policies and Regulations. Thanks again to our speakers, John Carney, and to Michael Underwood at Porter Wright, Morris, and Arthur, and of course the entire team there at Porter Wright that helped us to organize this event. And of course, most importantly, thanks to you for joining us and for your questions and for your participation. Now, a little bit later this afternoon, you're going to receive an email that'll have some additional resources on it. It also includes a link to a brief survey about today's program. Your feedback will help us to ensure future programs are relevant and useful for our members. We'll also separately be sending you a link to the YouTube recording of this event once it's posted on our webpage. Finally, just one thing, please join us on April 13th for our Stronger Together, Kentucky, Ohio, and the EU event, as we discuss with EU Ambassador to the United States, Stavros Lambrinidis, and other experts the importance of the trade and investment ties connecting the Cincinnati region and Europe. The event will also feature one-on-one matchmaking with businesses and experts who can help you enter or grow in European markets. And you can get more information about that on the event calendar on the EACC's website, europe-cincinnati.com. And you get more details and register there. So again, thank you so much for joining us today. Thank you, John. Thanks, Mike. And we hope to see you at another EACC program in the future.